Greetings. My name is Chase Colley, the Human Resources Manager here at SeQuential. Today I'm going to be giving a QSource presentation for the 2018 Benefits Overview. During this presentation, we're going to go over the benefits review process, a little bit about what we do behind the scenes to plan our benefits for the year. Then we'll go in and talk about our carrier and insurance provider decisions for 2018. I'll discuss some marketplace trends to show a comparison between what's out in the market and what SeQuential is doing. And then we'll give an overview of the application process and the materials that you need to submit. Please be sure to listen to this presentation in full. We have 3 very exciting wellness initiatives that we're going to be presenting today. Your participation in these programs can earn you up to around $2,000 in reimbursements toward your healthcare costs for 2018. Additionally, the very end of the presentation is especially important because it goes over how to complete your application materials and how to make it much easier on you moving forward. So let's go ahead and get started. So when it comes to our benefits review process, this is a year-long process. Typically, the new plan years run from January to December, but we work on our decisions all year long. Here at SeQuential, we partner with a brokerage firm called the Partners Group. We've worked with them for about 3 years. We meet with them in person on at least a quarterly basis and have monthly phone calls where we review the marketplace. We discuss the benefits that Human Resources here at SeQuential wants to be able to provide to our employees with the means that we have possible, and also keep our main goal of trying to keep these benefits as affordable and meaningful as possible. It's a really great partnership that we have with the Partners Group. We're really lucky to have them, and it's important for us to know that you guys are aware that we do work with these individuals year-long to help make the best decisions for our workforce here at SeQuential. So when we get into our renewal decisions or our carrier decisions for 2018, we're going to discuss our dental first. Currently, we have 2 different Delta plans. We have Delta Dental, which is available to all of our employees in California, Oregon, and Washington. And then we have Willamette Dental, which is available to our Oregon and Washington employees. Here, we're going to discuss the plan overviews of each plan. I'm going to start with the Delta Dental, which is the plan listed on the middle column of this chart. With Delta Dental, employees are able to pick their own dentist that is in the Delta Dental network. With this plan, every individual that is registered on the plan will receive their own $2,000 allowance to spend on dental services for the calendar year. You see here where it says calendar year deductible, there is a one-time $50 annual deductible for employee-only level coverage for any basic or major service that you have performed. If you have dependent care, also known as family coverage, there is a one-time $150 annual deductible for the whole family for any basic or major service that is performed. Here's how the plan breaks down. Your exam copay is going to be $0. So if you just go in for a checkup or exam, you're covered in 100% in full. Down below, we see our preventative care. In network, it's covered at 100%. Preventative care can also be considered restorative services, so stuff like your cleanings and your x-rays, those are all covered at 100%, nothing out of pocket. Basic services are covered at 80%. Basic services are typically considered fillings and simple extractions. Then we have our major services, which are covered at 50%. Major services are all the other major work, such as crowns, root canals, bridges, replacements, implants. And then finally, it's important to note on this Delta Dental plan, orthodontia, also known as braces, are not covered on this plan. Here's how the plan works. Hypothetically speaking, let's say you're going to go in and you're going to have a basic service performed. We'll use a filling for an example. The typical going rate for a filling is about $200. Since basic services are covered at 80%, that means the insurance company is going to cover $160 of that $200 bill. That remaining 20%, or $40, you as the employee will then be responsible for paying directly to your dental office. The $160 that the insurance company covered of that $200 bill will then get deducted from that $2,000 allowance that you as the individual have on the plan. The plan will continue to operate that way until you deplete your $2,000 allowance down to $0, at which point you'll be responsible for 100% of the dental services you have performed for the remaining calendar year. Please note it is important to remember that each individual on the plan gets their own $2,000 to spend for the calendar year. So if you have family or dependent coverage, each person gets their own allowance of $2,000. You all don't have to share that $2,000 for the calendar year. And that is how the Delta Dental plan works. Now moving over to the rightmost column, we have Willamette Dental. Again, Willamette Dental is only available to our Oregon and Washington employees, only because it's an extension plan that we get as a bonus for having Delta Dental. Willamette Dental works a little bit different than Delta Dental of Oregon. With Willamette Dental, you do not get to pick your own dentist. You have to go to a specific Willamette Dental facility, which there are several in both Oregon and Washington, so employees should have no problem finding a Willamette Dental facility close to their place of residence. With Willamette Dental, there is no maximum allowance that you can spend per calendar year like there is with the other dental plan. Instead, each individual service that you may have performed comes with its own individual copay. Inside your employee benefits guide for 2018, located in your insurance folder, you will see a menu card that has a breakdown of the specific services for Willamette Dental and how much those copays are. But as a brief overview, your exam copays are $20. Your preventative care are covered in full after you pay your $20 office visit copay. Basic services are covered at $20 for your office visit copay, and then our major services can range anywhere from $85 to $400 depending on the service. Again, I would encourage you to refer to that menu card in your Willamette Dental page that's located in the SeQuential 2018 Benefits Guide. Finally, down here at the bottom, orthodontia, also known as braces, are covered on this plan, and more details on how that works are located in the Willamette Dental insurance information located in your green insurance folder. That is the overview of our two dental plans and how those work. Moving on to vision. With vision, our carrier is LifeMap. LifeMap utilizes the VSP Choice Network, which is the largest vision network in the country. You should have absolutely no problem finding an office that will take the VSP insurance that is close to your place of residence. Here is how the vision plan works. Every 12 months, for a $10 copay, you'll receive your eye exam covered in full. For a $25 copay, every 24 months, you will get a $150 allowance towards hardware for your glasses. Anything that exceeds the $150 allowance, you will receive a 20% discount on. Every 12 months, for that same $25 copay, you'll have your lenses covered in full. It's important to note that these every 24 months and every 12 months don't mean from January to December on the calendar year. It is a true 24 or 12 months from your date of service. So hypothetically speaking, if you went and got your frames in June of 2018, you would not get another $150 allowance until June of 2020. However, anything that you needed in terms of additional frames during that 24-month period, you would receive the 20% discount on because you have already exceeded your $150 allowance towards hardware for glasses. So just to recap, every 24 months, it's for frames. Every 12 months, it's for lenses. Moving down below, for a $25 copay, you'll have your contact exam and fitting covered every 12 months, as well as a $150 allowance to go towards contacts. Again, contacts are every 12 months. That's everything for the vision plan. It's pretty straightforward and a pretty standard plan across the board. Now, as we look at our medical, this year we are really excited to announce that we are partnering with United Healthcare. There are a lot of great add-ons and enhancements to our wellness programs here at SeQuential that United Healthcare is able to bring to the table, which is going to help reduce the cost of your coverage and offer you a lot of opportunity for some reimbursements throughout the calendar year as long as you participate in those programs, and we'll cover that in just a moment. First, I want to go over the plan design. For individuals that are going to have employee-only coverage, you are going to pay $1,000 towards your deductible for the medical plan. The plan technically has a $5,000 deductible. However, SeQuential pays $1,001 to $5,000 of that deductible for you. So how that works is if you were to go to the doctor's office and you have a medical claim, you'll pay the first $1,000 of those claims that come in your name, and then the remaining $4,000 of that $5,000 deductible will get automatically deducted from a checking account that SeQuential has set up. So we cover the remaining part of the deductible for you. For family coverage, you're responsible for paying $1,000 of the deductible of claims that come in your name, and then you'll be responsible for paying $5,000 in deductible costs towards claims that come in your family name. Technically, for family or dependent coverage, there is a $10,000 deductible on the plan. What we tell employees is to take that $10,000 and split it in half into two separate $5,000 buckets. One bucket being for claims that come in the employee's name, the remaining bucket being for claims that come in all the dependents listed on the plan's names. This way, employees are only responsible for paying the first $1,000 of deductible costs that come in their name, while SeQuential picks up the remaining $4,000 of those employee-listed claims, just like they do for the employee-only coverage I described before. The other $5,000 bucket is 100% the responsibility of the employee and the family to cover, as SeQuential does not cover any of the deductible costs for dependent care. Moving down below, we see our out-of-pocket maximum. This is really important to keep in mind because the out-of-pocket maximum is the most money you're going to pay out of pocket per calendar year to cover your medical expenses and your family medical expenses. This top line here, you can see the out-of-pocket maximum is $2,350 for employee/individual coverage. How this works is you would pay the first $1,000 of your $5,000 deductible. SeQuential then pays the remaining $4,000. Once that $5,000 deductible has been fulfilled, the employee will have a remaining balance of $1,350 they'll pay towards claims until they max out the plan. For family level coverage, it works the exact same way, where employees are responsible for paying the first $1,000 of their deductible claims. SeQuential pays the remaining $4,000 of the claims that come in the employee's name. Family members are then responsible for paying their $5,000 of the deductible, which then in addition, there is another $1,350 they are also responsible for paying. So in total, the out-of-pocket maximum for family coverage is technically $12,700, but because SeQuential pays $4,000 of the employee's deductible, you can think of the out-of-pocket maximum for family coverage as $8,700 in a calendar year. What's really nice about your out-of-pocket maximum is anything that you pay towards your deductible, office visit copays, emergency room copays, and your prescription drug copays, all of that money gets contributed towards your out-of-pocket maximum. Here in a little bit, we're going to talk about some really exciting ways that you can get reimbursed for those copays and even some reimbursements on the medical premiums that you're paying out of your paycheck to cover your cost of healthcare for 2018. As we're moving down this list, you can see here that your office or special visit comes at a $40 copay. Preventative care visits are zero cost to you. There's no deductible, no copay. The thought behind this is for preventative care for your annual exams and checkups, it's far more advantageous for you to go in, get those checkups, because if there is a medical problem that we're unaware of or the doctor's unaware of, they're going to be able to catch it early, which ultimately will save you more money in the long run by catching those medical issues before they turn into something major. Down below is a really exciting enhancement to our benefits for 2018. We currently will keep our alternative care, which historically has only covered chiropractic care and acupuncture. We're really excited for 2018 to announce that massage therapy is now going to be included in the alternative care allowance. Here's how the alternative care works. Each individual that is registered on the healthcare plan will get their own $1,500 allowance per calendar year that they can use towards this alternative care, which again is chiropractic care, acupuncture, and massage therapy. How this works is you would make an appointment for the alternative care, and when you go to the doctor's office, you're going to pay your $40 copay. Let's use massage therapy, for example. If you go in to get massage therapy, you're going to pay your $40 copay. And then the clinic that you go to most likely is going to turn around and bill the insurance company right around $100 for that massage they performed on you. The $100 that the insurance company covered will then be deducted from that $1,500 annual allowance that you have on the plan. The plan will continue to operate that way with any alternative care service that you have performed until you deplete the alternative care balance down to $0, at which point you would then be responsible for 100% of the costs associated with the alternative care. We highly encourage employees to take advantage of this alternative care benefit. However, it is a very good idea to log on to unitedhealthcare.com or call the insurance company after your second or third alternative care appointment. That way we can verify what your alternative care balance is left on the plan to ensure that you have enough dollars left over to cover future appointments. That way you avoid being stuck with a surprise bill that maybe you weren't prepared to pay. Just to clarify, each individual that is registered on the healthcare plan gets their own individual $1,500 annual allowance towards alternative care. Moving down below, we have our urgent care. So let's say you need to go to the doctor's office, but it's after hours or on the weekend, and it's not quite something that needs emergency room services for. You can go to an urgent care facility and you can pay a $50 copay. Down below, your lab and x-rays, those are covered at $0 with no deductible. They're covered 100% in full. You can see here down below your CTs, MRIs, and PETs. Some of those larger tests that they run are covered on the plan under your coinsurance of 30%. Bumping down here to the emergency room line. When you go to the emergency room, there's going to be a $200 deductible for the ER. That $200 should be thought of as an admission fee or a ticket to get into the emergency room. That $200 copay only covers your entrance to the ER. Any type of surgery or emergency services that are then performed on you or anybody else that's registered on the plan once they're in the emergency room are still subject to the deductible, the coinsurance, but will also be applied to your out-of-pocket maximum for the calendar year. Finally, down below, we have a prescription drug coverage. What's nice this year is generic brand medications are $15 and they're not subject to a deductible. If for some reason you require a medication that comes in a non-preferred brand name or is a specialty drug, you can see here the copays for those medications are either $30 or $60. The majority of those medications are specialty drugs, such as medication for diabetes or high blood pressure. One thing to note, this year for prescription drugs, if you require medication that comes in a non-generic form, the deductible is only $100 this year before you can get those medications at the copay price. For 2017, that deductible was $250. So our partnership with United Healthcare this year has resulted in us being able to lower that prescription deductible for individual coverage. That is how the medical plan is structured. So just to recap, again, for employee-only coverage, you are only responsible for paying the first $1,000 of your deductible, and SeQuential will cover $1,001 to $5,000 of that remaining deductible. SeQuential will only cover $1,001 to $5,000 of deductible claims that come in the employee's name. It does not cover deductible expenses for any dependent claims on the insurance. One thing that we're really excited to be able to add to our insurance for 2018 is what is known as virtual visits. Many of us have been in a situation before where maybe the doctor's office is closed, it's on the weekend, we're really sick, maybe we have strep throat, or maybe one of our children that's on the insurance plan, maybe they got pink eye. One of these really easily self-diagnosed medical conditions that require medication that you just really don't want to have to go into the doctor's office or in urgent care, wait in the waiting room for up to, hour and a half, pay a $40 copay, just for a doctor to tell you what you already know, just so you can get that prescription written. With virtual visits, from the privacy of your own home, you're able to log on to unitedhealthcare.com, or you can use the United Healthcare mobile app, at which point you'll be connected either via webcam or via FaceTime on your phone to a virtual waiting room. Shortly thereafter, you'll be patched through and you'll be able to video conference with a real physician, talk about the symptoms you're experiencing, and as long as everything's pretty straightforward and self-diagnosable, and the physician agrees, they're going to go ahead and save you that trip to the doctor's office, and they're just going to write you that prescription straight to the pharmacy so you can just go there to pick it up. Again, saving the time and the hassle of having to go all the way to the doctor's office when you know you don't really need to be there. One of the greater things about this virtual visits is not only can you do it from the convenience of your own home, but the copay for a virtual visit is only $10 versus when you go to your doctor's office, it's $40, or even more when you have to go to an urgent care, it's $50. So really trying to make healthcare more accessible to our employees, more convenient, quicker access, one of the many new additions that we're really excited to provide to our employees with United Healthcare for 2018. Okay, so we just went over the structure of the medical plan, and now we're going to discuss 3 wellness platforms which are going to give employees and their spouses who are registered on the plan an opportunity to earn additional money to be applied to their healthcare expenses. The first platform that I'm going to discuss with United Healthcare is called Motion, also known as InMotion. With United Healthcare Motion, basically there are certain goals that you meet each day. If you hit all those goals every day, you can earn up to $1,460 per year. What's really great is if you have a spouse that is registered on the insurance plan, your spouse can also participate in this program and will be able to earn their own individual $1,460 to help go towards medical care costs. We'll talk more about how that works here in a moment. So with InMotion, when you fill out your insurance paperwork, the email address that you provide on your application for United Healthcare is very imperative, because once you get registered for your healthcare, United Healthcare is going to send you an email with instructions on how to participate in InMotion. When you get on the website for InMotion to register, you're going to be prompted with an option. It's going to show you this biometric device that's here on the screen. This is a Fitbit-like device that you wear around your wrist, and what it does is it counts your steps from the day or from the minute you wake up until you go to bed at night. This device is what helps you attain those goals, which in turn will help you earn these dollars that you'll be able to use for some of your medical expenses, which we'll go over here in just a moment. So when you log onto the website, you're going to be offered that free device that I just showed you. However, here on the screen are 5 additional devices. If you would like to upgrade your free device, you'll be prompted with the option to do so. By upgrading the device, instead of taking the free one, you'll be given a $55 credit that you can apply to one of these 5 specific devices that you see here on the screen. These devices are offered at a discounted rate, plus you'll get that that $55 credit. So for instance, if we look at the second one from the right, that is a Fitbit Charge 2. Those normally retail through the website at $95, but if you were to apply the $55 credit that you would get for passing on the free device, you would be able to upgrade to this Fitbit Charge 2 for $40. Please keep in mind that either the free device or one of the 5 specific devices you hear on the screen are required in order to participate in this motion program, which is going to help you earn up to $1,460 per individual to help cover your healthcare costs. If for some reason you are lucky enough to already own one of these 5 specific devices, you can decline on taking the free device and you can decline on upgrading to a new device. And the $55 credit will then go into your InMotion bank account, which we'll talk about more here in just a moment. So as I mentioned, these biometric fitness trackers, what their job is to track the number of steps that you take each day. And they track those steps so that you can work towards these 3 goals. The 3 goals we're going to cover, ironically, spell the word fit, which I think is pretty well in line with this wellness program. Here's how both you and your spouse, if they're registered on the medical plan, can each earn up to $4 a day. We see here F is for frequency. What that means is if you can complete 500 steps in 7 minutes, at least 6 times a day, you're going to earn $1.50 into your InMotion bank account. The frequency on this is 6 times a day, and each time you do that 500 steps, it does need to be 1 hour apart from the previous time that you did it. What's nice about the free device that United Healthcare supplies to you is it will vibrate as a reminder when that hour has passed and it's time for you to get up and start moving again. The second goal you can earn in a day is I for intensity, and that's 3,000 steps in 30 minutes. That can be described as pretty much a brisk airport walk. You're late for your plane, you got to get to the terminal, we're going to walk real fast in the airport. That's what you should think of when you want to try to imagine what it's like to complete 3,000 steps in 30 minutes. Again, that will get you $1.25 into your bank account each day that you complete that goal. Then finally, we have T for tenacity, and that T basically you'll meet that goal by completing 10,000 or more steps in a day. By meeting the tenacity goal, you will earn $1.25. So collectively, every single day, if you meet all 3 of these goals, you can earn $4 a day. Let's say hypothetically you only complete the F for frequency and the T for tenacity in one day. That's going to be $1.50 plus $1.25, which would equal $2.75 that you would earn into that InMotion bank account. So when we think about the InMotion bank account, to get it started again, you're going to log on to UHC, get registered through those instructions. But you're probably wondering how that bank account works and what you can use those dollars towards. So as you meet those goals throughout the year, the website and the application is going to be tracking how much money you earn each day. And then on a quarterly basis, what you've earned is going to be deposited into your InMotion bank account, which is directly tied to your health plan. These deposits, again, occur every quarter. As you begin to earn money into this bank account, when you go to the doctor's office and you have to pay your $40 copay or anything that you pay towards your deductible expenses, your pharmacy prescription copays, if you have to go to the urgent care, those copays. When you have those out-of-pocket costs, if you have any money in that InMotion bank account that you've earned from participating in this program, you can apply those dollars to cover those out-of-pocket costs so you don't have to pay that money out of your own pocket because you've already earned it. What's really great too is for the first quarter, since that initial deposit of what you earned probably won't hit your account until around April, you can save all of your receipts that you pay for those office visit copays, that alternative care copay, urgent care copays, anything you paid out of pocket for prescription copays. Save all those receipts for the first quarter, because once you get your first quarterly deposit for anything you've earned with those in-motion dollars, you can submit those receipts for reimbursement to United Healthcare, and they'll send you a reimbursement check in the mail. What's really great, again, about this plan is both you and your spouse, as long as the spouse is registered on the plan, can both participate in this program, and you can each earn $1,460 a calendar year, which is just under, excuse me, which is just under $3,000 for the calendar year. What's really nice is the money that you earn and the money that your spouse earns both go into the same in-motion bank account, and you can then use those in-motion dollars for your employee expenses, the spouse's expenses, or what's even better is if your children are registered on the plan, even though the children can't participate in the in-motion program, any dollars that you have accrued to that in-motion bank account can be applied to those out-of-pocket medical expenses for your children. As we approach the end of the year with this in-motion program, for employees that are having employee-only coverage, if you have money left over in your in-motion bank account at the end of the year, you can roll over up to $500 into the next year. For individuals that have employee and spouse or family coverage, what's nice is whatever's left over at the end of the year between what you and your spouse have earned, you can roll over up to $1,000 of that collective in-motion bank account into the next year. So you can start the beginning of the year off with some money in that in-motion account to help those out-of-pocket costs instead of saving the receipts for that first quarter again while you wait for your first quarter deposit. Has a really nice platform online and the app where you can check your progress in real time on a daily or monthly basis. This is the dashboard for your daily goals. So you can see here where it says F, the example here shows that this person's done 4 out of 6 500 steps in 7 minutes. So only have 2 left to go for the day. On the far right for T, you can see they only need 590 steps left to meet that tenacity goal of 10,000 steps in one day. On the far left here, it also shows your progress. What's nice is it can show you what you've earned to date in a given month, or also what you've earned year to date, as you see down there below. If you really want to dive into it, there's another display here of a month overview where you can see how well you did during the whole month in this chart, where you can see, hey, this day I met all 3 goals, maybe this day I didn't meet any, I met 2 on this day. So you could track your progress month over month and be really competitive with yourself to make sure that you hit more of those goals the following month. And again, just a better way to track your progress and know how much money is in your account. So that is the InMotion program, one of 3 wellness platforms that individuals can take advantage of for 2018. This next program is completely separate. It's called Rally, and it's a mobile app. Basically, with Rally, you connect this app to a Fitbit-like device, one of those biometric trackers. It will even work with the one that you get for free through InMotion. And this app has a whole different set of goals that you can participate in, track your progress, join challenges. As you participate in this Rally program, you will begin to earn virtual coins on the online app, and those coins you can then redeem to enter in sweepstakes to win some pretty cool prizes, or occasionally be able to use those coins to purchase gift cards. The best part about this Rally app is this health and wellness year-long program called Real Appeal. What this is, it's a 52-week program where you are put with an online virtual coach that you'll talk to face-to-face and check in with on a weekly basis. This program is at 0 cost to you, and the whole point of this program is to really help individuals change their lifestyle to be more healthier and improve the wellness in their life. What's great about this program is they will send you all the tools that you need in the mail to help you participate in this program. So as you can see here on the screen, once you register for Real Appeal, Each individual that's covered on your plan can register for this program, and each individual that's registered will receive everything you see on the screen in their first box. So there's a scale they give you so you can track your weight and your progress if weight loss is one of your goals. Here you see a food scale and a portion plate, which goes along with the better eating, wellness, kind of meal replacements if you want to go the weight loss route, or if you just want to change your eating habits. And then down below, you'll see it comes with a book of 5 workout DVDs, which are pretty modern to date. They're actually a lot of fun. There's a resistance band here that goes along with the workout DVDs. And then finally, these are the workbooks that come along with the program that you'll use with your virtual coach online. Now, a lot of these things look like they're focused on weight loss, but as I mentioned before, it really is more of a focus on changing your lifestyle. There are testimonials and results of people who, from participating in this program, have lowered their blood pressure, eliminated their diabetes, really were able to improve their wellness and overall lifestyle to attain either their health goals or even some weight loss goals if that's something they want to be able to attain. It's a really great 52-week program, and I like how they continue to send you the tools that you need as the program progresses. For example, around week 8 or 10, the program focuses on making healthy smoothies at home for breakfast as an initiative to help increase your wellness, or as a meal replacement if you're on the weight loss track. And when it gets to this point in the program, Real Appeal is actually going to send you one of those magic bullet-like blenders to help give you the tools to increase the wellness in your lifestyle. Again, all of this is covered 100% in what you're already paying for medical premiums, so no additional cost to you. Something really great to be able to take advantage of. Here we've got our Employee Assistance Program, which is another part of the wellness. The Employee Assistance Program is just an addition, some extra services that you can take advantage of through your healthcare. These things can include assistance with well preparation, financial planning advice. You can get one complimentary 30-minute legal consultation every calendar year. But probably the most advantageous thing you can take advantage of here is if you're under a lot of duress or you've experienced a very stressful situation outside of work, you do have access to 3 face-to-face confidential counseling sessions with an Employee Assistance Program counselor at no additional charge. The contact information for the EAP is listed here on the slide, but it is also listed in your SeQuential Benefits Guide located in your insurance folder. Finally, the third wellness platform that employees can take advantage of, which will result in saving dollars towards your healthcare, is a SeQuential sponsored wellness program. What we're going to be doing is every 6 months, SeQuential is going to host 3 wellness events or activities for you to participate in. If you participate in 2 out of those 3 programs in that 6-month period, SeQuential is going to go ahead and reimburse you the equivalent to what it costs to have employee-only coverage for that 6-month period. We'll do that twice a year. So potentially employees who have employee-only coverage, if you participate in 2 of those programs each 6 months, you'll end up at the end of the year with all of your medical insurance premiums reimbursed to you. It comes out to be right just over $300 every 6 months that you'll receive in a reimbursement if you participate in these SeQuential sponsored programs. Stay tuned for announcements for Human Resources throughout the year as to what these activities are and how you can participate. So just to recap here, we are really excited to be working with United Healthcare this year because of these wellness initiatives. We covered that In Motion program where employees and registered spouses can each participate on a daily basis to earn up to $4 a day into their In Motion bank account, which in aggregate could potentially accrue just under $3,000 for the family to be able to use in a calendar year towards those out-of-pocket expenses that are covered on the healthcare plan. There's that Real Appeal program that gives you access to that virtual coach to help work with you on any fitness, weight loss, or just lifestyle change goals that you may have. And then finally, there is the third program, which is the SeQuential sponsored program, where employees can participate in 2 out of 3 wellness activities every 6 months to qualify for that approximate $300 reimbursement for medical premiums. So before we talk about costs of the plans, I just briefly want to show you this slide here on marketplace trends. Nationally and through Oregon, on average, between 2017 and 2018, there's around an 8% increase in medical premiums, 11% increase in prescription coverage, 5% increase in dental, and a 3.7% increase in vision. The reason I want to show you this is because for 2018, there's barely been any increase in the insurance premiums, all due to our partnership with United Healthcare. You can see at the top here, this is 2018 costs, 2017 is on the bottom. You can see for employee-only coverage for medical insurance, it only went up 40 cents a paycheck. For Delta Dental, it's gone up about $4, but the reason why it's gone up $4 a paycheck is because in 2017, individuals on the Delta Dental plan only had a $1,000 allowance to spend per calendar year, and now for 2018, they're going to get a $2,000 allowance. With the Willamette Dental, it's only gone up just about 50 cents. And you'll notice that the vision costs are not listed on here because the vision rates are the same in 2017 and 2018. There's a breakdown of these costs in your SeQuential benefits guide, as well on the plan selection forms that you'll be asked to complete. And we'll go over more details on how to complete those applications at the end of this presentation. Group term life insurance. So employees get a complimentary $50,000 life insurance policy that SeQuential pays 100% of the cost of. It's at no cost to you. It's something that we just want to make sure that your families are protected in the event that something catastrophic were to happen. Employees have the opportunity to purchase additional life insurance. You can purchase up to a $100,000 life insurance policy for a guaranteed issue. Anything over $100,000, you can apply to get, and you'll be subject to an approval process, which is pretty straightforward, pretty easy to be able to get that higher life insurance policy. Spouses are eligible for up to $25,000 life insurance policy, and children can get a $10,000 life insurance policy. If you're interested in purchasing additional life insurance, please contact your Human Resources Department for information on how to do so. Something new for 2018 that we're really excited to introduce to all of our employees is short-term disability. We're bringing short-term disability back to our insurance benefits for 2018. Short-term disability protects you as the employee for medical-related scenarios that may prevent you from being at work that are not work-related. These can consist of things such as personal injury or even things that maybe are celebrated like pregnancy. Here's a hypothetical example of how this would work. Let's say you're on vacation and you go skiing and you injure your leg, and as a result, the doctor tells you that you can't go to work for 8 weeks because of your injury. That can be really scary for most people because that's 8 weeks of income that you might be dependent on that you're not going to be able to receive. However, with short-term disability, after you've been away from work for 8 days, you've fulfilled what's called your elimination period. After being away for 8 days, you can file your short-term disability claim, and what will happen is the insurance company will pay you 60% of your weekly wages, up to $1,700 a week, and they'll do that for up to 12 weeks. That's at no additional cost to you. SeQuential pays the cost of that insurance policy for you to have in the event that you have something happen to you outside of work that's going to prevent you from coming to work. So now here are the enrollment instructions. Please pay attention because I'm going to be saying a couple things that are going to make this process much easier for you, considering there's a lot of paperwork that needs to be completed. Each employee is going to be responsible for completing the plan selection form. The plan selection form consists of one authorization for your medical, one for the dental, and one for the vision. You're simply going to check the box that corresponds to the plan that you want to enroll in. Then down at the bottom section where there's a paragraph, you're going to fill in your name, the dollar amount associated with the the plan that you've chosen, and then you'll print, sign, and date the bottom. If you're going to decline coverage for medical, dental, or vision, towards the bottom of the form, you'll see a box that you can check indicating that you wish to decline that level of coverage, and you just print, sign, and date the bottom. You'll want to complete that for each of the 3 plans that SeQuential is offering: the medical, the dental, and the vision. We'll need you to complete all new applications for 2018, so you're going to have a United Healthcare application, a dental application, whether it's Delta Dental or Willamette Dental, the one that you choose, your vision application, and then most importantly, the life insurance beneficiary form. For all the application materials, there's a lot of confusing stuff that are housed in those applications. What I can tell you is on those applications, the only things that you need to complete are your personal information and the personal information of any dependent that you're going to have registered on the plan. By personal information, all I need are the names, birth dates, genders, and social security numbers, as well as your hire date on those applications. You can ignore everything else on the applications, just fill in those pieces. Again, names, birth dates, gender, social security numbers. When it comes to the life insurance beneficiary form, if you don't have your beneficiary's social security number, I can take a home address instead. Finally, most importantly, please do not forget to sign and date the back of all of your applications. I need your application materials back as soon as possible so we can ensure that we get your information into the system in time and you can get your insurance cards in time for the plan to start for you. So there's no delay in getting your insurance card. If you have any questions whatsoever about how to complete your application materials, need more clarification on the plan designs, please don't hesitate to contact the Human Resources Department or your QSource team here at SeQuential. We're more than happy to help work with you to get these materials completed because insurance is something that's very important to everybody here at SeQuential. We want to make sure that you're covered and have the resources that you need moving forward for 2018. I want to thank everybody for your time today. I hope this presentation was beneficial. And again, don't hesitate to reach out to Human Resources or your QSource team if you have any questions. Thank you and have a great day.